Good afternoon. Welcome to the History Study Group for February. I'm Rick Richardson, and normally you expect to hear our resident raconteur, Dr. Cook. I'm sure he'll be introducing again, but not today. Monthly, we have History Study Group presentations, mostly by residents and sometimes by outside specialists. Everyone is welcome, certainly to watch on television, but also to attend in person. And I'm sure by the time the next session or two rolls around, Governor Northam, in his good, warm heart, will agree to loosen up our audience sizes a little bit so that we can return more sense of normalcy. Today, we're delighted to have one of our neighbors, Bill DeShazo, present. Dr. Bill and his wife Charlotte have been our neighbors for about a year and a half. Bill is an Alabaman. Is that how you say that? Alabaman?
Yes.
Okay. Bill is an SMU undergrad and medical school at Southwestern Medical School. After a stint in the Air Force, he decided to make the beautiful people even more beautiful in Tinseltown and moved to open a plastic surgery practice in Los Angeles. Since his retirement, and it's going to be the subject of his presentation, Bill participated in 34 medical missions, which is really extraordinary. He's only 117. But that's an awful lot to do in a short space of retirement, but I'm sure he's very proud of his accomplishments, and we're going to look forward to hearing from them. Bill, take it away.
Okay, thank you. A cleft lip and cleft palate is one of the most common congenital anomalies. And as you can see, there are over 7,000 of these children born each year. There is some variation with the ethnicity of the babies. And they also will vary quite a bit with, as you can see, that little boys have the cleft lip and palate more common than the girls. And luckily, the bilateral deformities are much less common because they are certainly more difficult and they're just much worse. The causes of cleft lip and palate are varied. The main one is genetics. And I've seen families where 2 of the children would have a cleft, and even 3 in the same family. Frequently, there'd be a father or another relative with a cleft. They also occur in various syndromes, and are affected by environment. They're more common in diabetics. Smoking seems to play a part. Also, the lack of folic acid may be a partial cause. Folic acid, or the lack of folic acid, is more important in spina bifida, but has been related to cleft lips and palates. The problem with folic acid, however, is that the young mother needs to have adequate levels at the time of inception, and so it doesn't do much good as a prenatal capsule. Some of the patients are just spontaneous. The cleft palate causes more problems than the lip defect causes. The palate normally separates the nasal cavity from the oral cavity. So this means that the baby's not able to suck. So if the baby is being bottle fed, one has to make the hole in the nipple larger so that the milk flows more freely. Or if they're breastfed, the mother has to massage the breast to help bring more of the milk more freely. Also, with the cleft palate, not separating the nasal cavity from the oral cavity, when the baby swallows, some of the milk comes through the nose, some of it goes down into the stomach. So the mother needs to be taught that gravity is important. You have to be certain that the head is higher than the stomach, so that when the baby swallows, most of the milk goes down into the stomach and less of it comes out through the nose. The communication of the nasal cavity and the oral cavity can also affect the ears. The inner ear or the eustachian tube opens in the back of the nasal cavity and is affected by this milk and swallowing. The lack of the opening in the palate also affects the speech. I'm sure most of you have heard people who talk with a very nasal type of speech because of this communication of the nasal and oral cavity. The cleft lip primarily affects the appearance. It's not anywhere near as important in speech and feeding, but affects the socialization of the patient. This shows what a fetus looks like at about 7 weeks of gestation. Normally, the lip is formed approximately 6 weeks of gestation. And if you think about it, the woman usually just misses her first period at 6 weeks. So about the time she realizes that she's pregnant, the lip is already formed or deformed. The palate completes its formation a couple of weeks later, approximately 9 weeks. So here's how we identify the cleft lip. It can be on either side, either left or right. And you can see that the complete cleft lip extends up into the nose. The incomplete cleft lip does not go up into the nose or nostril. And of course, the bilateral goes up into both sides of the nose. This portion right here would actually form part of the gum and is where the 4 central incisor teeth are usually present. There can be a midline cleft lip, but that's extremely rare. The palate is also somewhat similar. It can be either on the left or on the right side. And the incomplete cleft palate does not go into the nostril, whereas the complete cleft palate does extend all the way up into the nose. And of course, the bilateral is the more severe deformity. This shows the incisions that we make for a cleft lip. And the incision goes through the skin, through the muscle, and through the mucosa. And then the lip is reconstructed in order to try to get the more normal Cupid's bow of the lip to make the patient look more normal. These mission trips would have to be set up a number of months to a year in advance, and we would go as a team. The team would usually consist of about 15 to maybe 20 people, depending on the number of operating rooms that we would be using. We would always have one mission director, but then if we had 2 operating rooms, there would be 2 surgeons, occasionally 3 surgeons. Sometimes we would have access to 3 operating rooms. We would also need the anesthesiologist. The anesthesiologist would have to be experienced in doing babies. And we would always need one more anesthesiologist than the number of operating rooms. So if we had 2 rooms, there'd be 3 anesthesiologists. If there were 3 rooms, we would need at least 4. The ideal age for repairing a cleft lip is about 3 months of age. That's when we like to do them, if possible. They need to be about 10 pounds of weight. The cleft palates, about 1.5 years of age or older, but ideally 1.5 years. We would also need operating room nurses. Would need 1 more nurse than there are operating rooms. Need recovery room nurses. We usually have 1, sometimes 2 pediatricians, and a number of volunteers. The volunteers would be taught how to run the autoclave and package instruments and transport the children back and forth. Sometimes we would have a dentist, or occasionally 2 dentists, and a speech pathologist. So it was quite a number of people that would go on these missions. The missions would be about 2 weeks in length. So here's what it looked like when we would come into the airport. This is in Harbin, China, and you can see all these boxes. They'd have the autoclave, bandages, bags of IV fluids, medications, dressings, but quite a few boxes to take care of. There are a number of organizations that send out lip and palate repair. I went with just 2 of the organizations. One of them was Rotoplast, And Rotoplast was started in a Rotary Club and was sponsored by Rotary Clubs. And the plastic surgeon that started this in San Francisco was a friend of mine. And so when I retired, I called him and told him that I was ready to go on some missions. Being in private practice and solo practice, I was unable to take time off because if I wasn't working, there was no income coming in. So I went with Rotoplast, and then Alliance for Smiles branched off and started setting up missions, and I went with them a number of times. I'm sure most of you have seen ads for Smile Train. Smile Train is a funding organization, and it receives donations, and then they help sponsor a number of these missions. They would help fund them. My very first mission was to Valdivia, Chile. And here's the day that we arrived in Valdivia. Valdivia is south of Santiago by several hundred miles. And here's what a little patient looks like. This patient has an incomplete right cleft lip. And then in the after picture, the patient is about a week post-op. This patient was actually from Cochabamba, Bolivia. And you may not know it, but Cochabamba is where Butch Cassidy and the Sundance Kid met their demise. Here's another little patient that has also an incomplete, but on the left side. And there the patient is post-op. And if you notice here this plastic tube, this is the endotracheal tube, which goes into the trachea or windpipe so that the patient can be breathing during the operation. And the hand that you see, of course, is that of the anesthesiologist. This is a cleft palate, and this is during the surgery, and you can see the instrument that's has to be used to expose the operative site. This cleft palate is a complete left cleft palate. The endotracheal tube is hidden underneath this part of the retractor. And the main thing in repairing the cleft palate is to close it in the midline here, which then separates the oral cavity from the nasal cavity. And this is left open on either side, but it does not provide an opening to the nasal cavity. And this heals very well. It's sort of like when you fall down and skin your knee. It just heals over very easily and works well. And here is a bilateral cleft lip. And this is a bilateral complete. Here's another little patient with a complete left cleft lip before, and then about a week after. This is a bilateral complete cleft lip before and a week after. This sort of intrigued me to see this in Vietnam. And this was before the pandemic, and the people are wearing masks, but the reason is that these motorbikes and motor scooters burn a mixture of gasoline and oil in their engines. So there are lots of fumes on the street. And so a lot of people would wear masks. But what I thought was interesting was this young lady back here. She was about 20 years old. And you can see she has a hat with a wide brim, wearing a mask, has on a t-shirt, and is wearing opera gloves that cover her hands and her shoulders. She also is wearing long slacks. They frequently would have on high heels riding these motorbikes. The reason they were covered was that they don't have sunscreen, so they cover up because the lighter skin girls are more attractive, so they tend to avoid sunlight. And here's another little baby with a complete left cleft lip before and right after the operation. And if you'll notice, there's a bandage on the arm at the elbow. These are elbow restraints so that the baby doesn't pull on or scratch the incision. So that's important after surgery. Here's another cleft palate, before and after. And in Vietnam, on the Sunday that we were there, we took a day off to go and visit Buddhist temples. But each of us had to ride on the back of a motorbike. And in doing this, I wondered, what in the world am I doing riding on the back of a motorbike, no helmets, in a third world country? But it was interesting. And they were appreciative, and they gave us all hats and a bouquet of flowers. And here's the hospital in Juarez, Peru. We also did some of the older patients who had never had a repair. This lady was, I don't know, 30 or 40, and has a rather severe cleft lip on the left. And she said afterwards, "Now I can kiss my husband." And this is another cleft palate repair. Here you can see that the endotracheal tube has shifted out from underneath the retractor. And this is one of the older children. She has an incomplete right cleft lip because you see it doesn't quite go into the nose. in Venezuela, there was a problem when we'd go back and forth from the hotel to the hospital. We would need a police escort, and so we'd frequently have 2 or 3 motorcycle cops to lead the way for us. And here's another little baby, before and after. This is also an incomplete left cleft lip. The thing about China is that they have lots of people. And they would frequently have some sort of presentation for us the first day of our arrival. And so they had this to entertain us. And then we'd go into an auditorium, and there'd be a lot of talking, and they would certainly talk well about the Chinese, and sometimes mention a little bit about the people from the U.S. who have come over. But it was sort of interesting. And here's one of the dancers in a sort of a native costume. You probably haven't heard of Harbin, China, but it's in the very northeastern part of China. It's actually above Korea. And in Harbin, there is a Siberian tiger reserve. It's quite large, and part of it, they have a visitor park. This is in the visitor park, and there's about 90 acres in just the visitor park. And I think they have about 30 adult tigers in this area. And so on our Sunday there, we did the tourist thing and went out on a bus like this to see the tigers. This SUV is driven by the park attendants, and it has some ship cargo netting over the top of it. And someone in the RV would throw a chicken on top of the RV, and so the tigers would leap onto the top of this SUV to eat the tiger. You can actually see the chicken there. And of course, there were some cubs.
Is that you?
That is I, holding the little cub. Well, the adults are a lot bigger. And here's a view in the operating room. We're working on a cleft lip. This was also in China, Harbin. Harbin also has an ice festival each year where they have ice sculptures and all sorts of things. An ice cave, I think. I took this picture out of my hotel window, mainly to show the cities have a lot of these big apartments. This is what the city is made up are these big apartment houses. And there are no elevators in these, so they're all walk-ups, but they just dot the entire city. And a city in China is 1 million people or more. I mean, these cities are big with lots of people. And here's another bilateral complete cleft lip. In China, I thought it was interesting that they have these, the babies frequently have the open crotch. And we're not used to that here in the United States. They do scold the babies when they make a mess in the street or in the house, but it's also noted that the babies are potty trained a lot earlier than they are here in the U.S. But there's still a lot of these bare bottoms that this is in Africa and well, West Africa, and they set up a tent, an air-conditioned tent for us to use post-operatively. So these are our, this award was for our patients. And it used to be that hospitals had wards and that, to have patients. Here in the United States, especially in the past decade, we've attended to private rooms, but used to be they would have wards. And this is a very common sight in Africa, carrying the babies on their back like this. You don't see any baby buggies. As I say, this is just extremely common. That's it. That's the way they carry their babies around. With the 2 little feet sticking out front. This is another common sight in Africa, how the people, both men and women, would carry big loads on their head like this. It was fantastic to see the size and the weight of some of these. And when we were in Africa, the Sunday happened to fall on Palm Sunday. So we went out on our tourist on Palm Sunday and encountered this group of people going to church. And you can see their palm fronds. And they had music with them too. And this, I took this to show the local mall, the store mall, these one-room houses with all of the produce and boxes and goods. And with the ward beds, each ward would be in Africa, each ward would be in a separate building. And there'd be 20 to 40 beds in a ward. So that was sort of interesting. The operating room would be in a very similar building. And I always thought that bats lived in caves, but the fruit bat lives in trees. So in the daytime, they'd be hanging out in the tree, and then at nighttime, you'd see flocks of bats going off. And here's a young man with a very wide, incomplete right cleft lip. And another young boy with a incomplete left cleft lip. And he's about a week post-op. And then we did this lady. She had a very wide bilateral cleft lip. I thought this was interesting because this is outside of the pediatric ward where our patients were located. And the parents would wash the blankets and clothes and then put them on bushes to dry outside. The hospital did not do any laundry work. And some Maasai boys and this is how some of them lived. It's a one-room hut. It had an open fireplace. And so this was home. And these are the missions that I went on. So my last mission was in 2017. Any questions or comments?
We will ask our studio audience for can I do the first? China competes with the United States hard militarily, economically, even in space today. I would have thought they would have the internal resources to manage cleft problems. Could you comment?
Yes, they do have surgeons that do a lot of their clefts, but they have so many clefts. It was also interesting that the Chinese surgeons were set in the techniques that they use. They're very nationalistic. Taiwan has an excellent cleft lip center, but the Chinese don't like to talk about that good Taiwanese center. We also tried to teach local surgeons to do some of these procedures, and would have a Chinese surgeon assisting me, and I would let them do some of the cases, but they wanted to do it their way.
I am stunned by your contributions. It's amazing what you've done. Do you contribute the cleft palates more to nutrition, specifically folate deficiency, or genetics, or overall nutrition? Did you come to any conclusion?
Well, the genetic is, I think, the biggest factor.
Oh, okay.
Because, as I say, I've seen 2 and 3 children and a father with clefts in one family.
Would folate prior to conception have made any difference? I wonder. I guess there's no way to know.
It's not completely known, but there are a number of places and people who think that it does. And in fact, Belize, I think, has started putting folic acid in the salt or bread or something to help prevent clefts.
Could you say some more about working with the Chinese doctors? Obviously they must do, before you came, some of them were doing cleft palate repair. Was there a difference in outcome with that?
I like to think there was. And I do think there was, because the technique of cleft lip repair was actually started here in the United States, in Miami, Florida, really. And it has been modified some through the years, but the basics of it were from a plastic surgeon in Miami, Florida.
About what year?
1940.
The reason I'm asking is because there's a plastic surgeon here in town, in Richmond, who does cleft lip, cleft palate repair. He had one himself, and it was his motivation. Do you know him, maybe?
No,
I think his last name is Smith.
Interesting.
Did you have any problems with the conditions of the ORs themselves in some of the countries?
Yes. The most primitive place that I've operated on was in Tanzania, and at this particular hospital, there was no running water. There had to be someone to help pour water over our hands after we scrubbed with the soap, and someone would pour water over our hands. And in fact, the bathroom there was someone who had to come pour water in the toilet tank after it was used. So that was the flushing. But the Chinese usually had very good equipment, and their operating rooms were up to good standard.
Any other questions, comments? Thank you, Dr. Bill, and thank you all for listening. We'll see you next month.